and injuring somebody else.
And another person was killed when wheels failed on the Thunder Mountain roller coaster. The cited causes of all of these accidents were staffing and maintenance.
This is not the Disney that many people grew up with, and they all happened after McKinsey came on board.
But did McKinsey face any consequences for their bad advice?
McKinsey escapes accountability in a way because they are behind the scenes. It's all about secrecy, with them. Our advice is to you, and it's confidential. If you guys do great, wonderful, you take all the credit. If you screw up and things go bad, it's on you, it's not us.
If the project fails, the decision ends up being bad, it's like, well, clearly you hired the best consulting firm, so it must have been something else.
There's this symbiotic relationship between McKinsey and their clients. When something goes wrong, all McKinsey did was make recommendations, and all the client did was follow them.
Who wrote this?
He did it!
It's a way to cover your ass, which is a very common expression in the business world.
This system is great for short-term profits and shareholders, but not so great if you care about jobs or safety. So what happens when you apply this mindset to the industries that we literally can't live without? That's when things start to get even darker.
Healthcare is pretty much McKinsey's bread and butter.
Bread prices.
Hospitals, for sure. Insurance companies, managed care companies, pharmaceutical companies. Top 5 McKinsey clients would be companies like Johnson & Johnson and the big managed care insurance company, Anthem, Aetna, Blue Cross Blue Shield.
Let me say that again. McKinsey's biggest money earner is our healthcare system, and it's also where they've done some of the most damage. In 2018, McKinsey was contracted with the nonprofit hospital Providence Medical to design a program to get more patients to pay their medical bills.
Providence Hospital is a tax-exempt hospital. They're required to provide free care to poor people. And they were looking for any way to cut costs, and they turned to McKinsey to find a way to convince poor people to pay bills, even if in many cases they actually were not required to pay those bills.
McKinsey literally wrote a script for hospital staff to read to these patients. Staff were not allowed to take no for an answer and were told to take just $3 if that was all the patient had.
If they didn't pay, if they didn't get anything out of this, in some cases they would refer it to a third-party debt collection agency. It would, destroy these people's credit rating.
And now Providence is being sued while McKinsey is once again not being held accountable, legally, financially, or otherwise. And while they're working for private sector clients, they're also working for the government agencies that are meant to be regulating them. 2 more McKinsey clients were Philip Morris and Juul.
McKinsey was also working for the FDA office that regulated tobacco. At the same time, they had these clients. And you see the reporting in our book that said that actually the people at the FDA did not know that McKinsey was advising the tobacco companies. And this is the same, with Juul. This is when the FDA was cracking down on these e-cigarettes. And pharma, the same thing. And most infamously, they're working for opioid makers, especially Purdue Pharma.
Conflicts of interest are the name of the game for McKinsey. They're like business-class mercenaries. They'll fight for any and every side that will pay them, and sometimes even ones that don't. In 1997, the state of Illinois was trying to reduce welfare spending. They needed help, and McKinsey generously offered their services for free.
One of the tricks McKinsey does, they will often come in and do pro bono work. And this is often a way just to kind of get in the door.
Once their foot was in the door, they were called back by some of the same state officials 20 years later to help, this time with restructuring Medicaid. And this time, it wouldn't be for free. Around the same time, Illinois hit some budget troubles. It was found that they were in about $1 million of debt to basic medical services while sending $75 million to McKinsey. It was also found that under McKinsey's project, the state was paying $63 billion to 7 private insurers, 4 of whom were also McKinsey clients. According to the Illinois comptroller, this taxpayer money was spent with less oversight than a purchase of paper clips. Like a vampire, McKinsey got themselves invited in with pro bono work, and now they were sucking Illinois dry.
They're on all sides of the food chain, in the healthcare industry, and there's just so much money there.
On their own website right now, McKinsey admits that healthcare in Illinois should be improved, specifically around opioid use. So cool that the solution to these problems they have actively helped create is bold collaborative action. It's like if someone came over to your house and used all your dishes and then was like, oh, according to my research, someone should probably do the dishes.
Dishes are done, man.
Once they sink their teeth into our governments, they stay for as long as they can. They make sure these agencies don't even remember a time before them.
You just end up relying on these people who are, getting paid multiple times what a civil servant will be paid, and aren't really accountable to the public in a serious way, and may just come through for a few months at a time and then move on to something else. And so you don't build up this expertise, and you just don't have this capacity to do things that states need to do.
They do all this while hiding behind the fact that they don't make the decisions.
This guy, Richard Elder, was like, look, we don't do policy, we just do execution. We're not here to make choices about what policies are good. All the values were about doing right by our clients, having an obligation to dissent, but that doesn't mean the dissent is going to go anywhere. It just means you're not going to get fired for speaking out.
A former McKinsey employee told Michael that a manager would advise new recruits to wedge yourself in and spread like an amoeba. Once in, you should spread yourself in the organization and do everything. In other words, act like a Trojan horse. He was talking about their clients, but as we've seen, the McKinsey amoeba has wedged its way into every part of American life. So what should we do about it? Well, the DOJ is investigating their work on opioids criminally for the first time, and some politicians have even talked about banning McKinsey from federal contracts. But most of these problems aren't even unique to McKinsey. If we just banned one consulting firm from federal contracts, the others would likely just fill in the gaps.
The reality is there are companies called Bain and Boston Consulting Group and Deloitte and Accenture, and they are offering kind of the same product. And I don't think that the results would be that different.
Ultimately, we need to untangle the dependency on consulting McKinsey has fostered in our government.
Things are set up in such a way where if you just cut off the consulting firms, I don't think you can build up that capacity overnight. This is like a kind of a generational long project. And I think that requires, governments paying people more and creating workplaces that are more appealing, as well as just a philosophical change of public-private partnerships are not the default best way to go, and government should actually learn how to do things well. Again, we've done it before.
And what about the army of young MBA grads ready to keep the consulting industry marching on for another 100 years?
I would tell them that these organizations will promise you that you can do work that is exciting and prestigious and improves the world with smart people that pays well. You can have it all. And I would just tell them that that's not true. I think I'm really much happier than the cohort of people that I worked with at McKinsey, even though I make so much less money than them. And my life and career is less stable and predictable. But you have privilege by being in this position, and you have some kind of opportunity and I think to some extent an obligation to use that to actually make the world a better place. And I think you will end up being happier for it.
Thanks for watching The Classroom. We're always looking to do more stories like this